So finally the most awaited video is out. In this I would be discussing important topics for the paper 1. You have to take this video very seriously because as a senior of yours I have put in the best effort I can and created a sum of the topics which are very high yielding for you all. Out of 120 questions you will be able to do 115 questions just from these important topics.
Oh यार ये कितनी awesome है यार.
Important topics and study from whatever notes or material you have. And अगर आपके पास कोई notes या material नहीं है तो read from the standard test because जो question paper है वो text book से ही बनना है. अगर medicine की बात करूँगी तो you have to read Harrison और Davidson, and if I talk about pediatrics then you have to read Ghai in that. Why I am telling about medicine and pediatrics? Because in the paper 1 medicine and pediatrics ही आपसे पूछा जाएगा. So let's start with the paper 1 important topics. As we all know the pattern for the paper 1, we will be having 90 questions from general medicine, 1 to 2 questions from derma, 2 to 3 from poisoning, 1 to 2 snake bite, vaccine, vitamin, psychiatry, pediatrics. This is all going to be there in your paper 1. So I would be discussing it in 3 parts. First guaranteed topics, then VIP topics, and third is important topics. Why I have differentiated guaranteed and VIP is कि guaranteed मतलब एक single topic है जो आएगा ही आएगा, एंड VIP टॉपिक्स में क्या होता है कि लिस्ट होती है 2-3 सिमिलर टॉपिक्स की जिसमें से तीनों में से कुछ भी आ सकता है. सो गारंटीड टॉपिक्स जो होंगे 30 क्वेश्चंस उसमें से आएंगे, एंड बहुत बड़ी लिस्ट नहीं है, वो बहुत क्रिस्प और शॉर्ट लिस्ट है. जो हमारी अप्रोच रहेगी वो रहेगी कि फर्स्ट वी हैव टू कंप्लीट द गारंटीड टॉपिक्स, देन वी हैव टू डू द VIP टॉपिक्स, एंड इन द लास्ट वी विल डू इम्पोर्टेंट टॉपिक्स. सो what are the guaranteed topics? First guaranteed topic is diabetes. In diabetes you are going to have 3 questions at least. या तो वो डायबिटीज मेलाइटिस पूछेंगे और इंसिपिडस और गेस्टेशनल डायबिटीज मेलाइटिस, या उसके रिस्क फैक्टर्स, या फिर ट्रीटमेंट में जो ड्रग्स देते हैं, एंड डायबिटिक कीटो एसिड. नेक्स्ट इज इंसुलिन क्लासिफिकेशन. गारंटीड क्वेश्चन मतलब लगातार 5 to 6 ईयर से कंटिन्यूसली वी टॉक अबाउट, ये हर पेपर में होता है 1 क्वेश्चन जिसमें पूछते विच वन ऑफ द फॉलोइंग इज नॉट अ शॉर्ट एक्टिंग इंसुलिन और विच वन ऑफ द फॉलोइंग इज नॉट अ लॉन्ग एक्टिंग. तो यू हैव टू डू इंसुलिन क्लासिफिकेशन. Third is osteoporosis. You are going to have 2 questions from this. Then anticoagulant, the pharma, that what are the oral direct thrombin inhibitors, heparin induced thrombocyte. Fifth topic is asthma. You are going to have 3 questions from this. Malabsorption syndrome, irritable bowel syndrome, jaundice, acid base balance, hirsutism treatment, Glasgow coma scale, MI. OSA means obstructive sleep apnea, G6PD deficiency, and heart failure management. These are the 15 topics from the medicine. And pediatrics, milestones. In milestones you are going to have at least 2 to 6 questions. Then autism, various programs like IMNCI, ICDS, Rashtriya Bal Swasthya Karyakram, JSSK, home based scan of young child, and Mission Indradhanush, and vaccines. So I have taken 15 topics from medicine and 4 topics from pediatrics. That means out of 19 topics you are going to have 30 questions in your paper. So first of all you have to do these 19 topics. So guaranteed 30 questions will be right of yours. Then let's shift towards the VIP topics. In VIP topics let's start with the derma. In derma, out of these 3 topics, slap cheek rash, alopecia, and acne vulgaris, you are going to have 1 to 2 questions. From poisoning, if I talk about, guaranteed 2 to 3 questions. You have to do OP poisoning, antidotes for drug poisoning, paracetamol poisoning. So OP poisoning and paracetamol poisoning are a very trending topic. So you have to do these 2 first, then go for copper sulfate and lead. Third is snake bite. Again a VIP question, guaranteed 1 to 2 question. So you have to do the snake poisoning and its management. Next is vaccine. In vaccine again 1 to 2 question, in which hepatitis B vaccine and varicella vaccine are the most trending. In vitamins, vitamin D, C and A. These 3 vitamins you have to do by your heart from the Harrison or whatever source you want. So 1 to 2 question guaranteed. From psychiatry, bipolar depression, guaranteed question. And from pediatrics, these 7 topics: marasma, Kusharka, acute malnutrition, autism, attention deficit, resuscitation and temper tantrum. These are the ultimate VIP questions. So, these were from the small subjects. Let's go towards the medicine. Medicine, as we all know, 96 questions are from medicine. It forms a huge chunk in your question paper. So, in medicine also they have some favorite units of theirs. First is respi, next is kidney and the third one is CVS. These are the favorite units of the medicine faculty. So, if I talk about the VIP units, so they have 10 to 14 questions just from the respiratory unit, in which you have to read TB, types of respiratory failure, pulmonary embolism, pneumoconiasis, interstitial lung disease, bronchiectasis, pleural effusion and pneumothorax, and obstructive versus restrictive pneumonia, ARDS, COPD and lung cancer. These 13 topics will help you to crack 10 to 14 questions of the respiratory unit. So, read the respiratory unit very carefully. Then kidney, out of just these 5 questions, you are going to have 4 to 5 questions guaranteed. So, see chronic kidney disease, nephritic nephrotic syndromes, diuretics, the side effect uses, renal transplant and renal system physiology. You have to do these topics from kidney unit. Then if I talk about the CVS, then 8 to 9 questions guaranteed. Arrhythmias, it can be ventricular tachycardia, fibrillation, PSVT, atrial fibrillation or flutter. Then MI, its management and diagnosis, antihypertensive drugs, heart sounds, coronary artery disease and heart failure management. These topics are guaranteed, which you are going to face in exams. Now, other than that, I have accumulated all the VIP topics at a single list. So, you can take the screenshots of the upcoming topics, in which I have covered meningitis, hepatitis, food poisoning, inheritance, what are the causes of dilated pupil, small size pupil, causes rheumatoid arthritis. This is the probable diagnosis on the behalf of clinical history. In this, you have guaranteed 2 to 3 questions. They will provide you some clinical scenario and you have to diagnose what disease they are talking about. So, you have to read these topics. Then nerve palsy, they give you history and you have to identify which nerve palsy they are talking about, the third nerve palsy, the sixth nerve palsy or the fourth nerve palsy. Then from these 3 topics, PCOD, thyroid disorder and hyperprolactinemia, 2 to 3 questions. Then they will again give you a case scenario, you have to identify which leukemia they are talking about and about sickle cell, thalassemia, multiple myeloma. And thyroid is very important, you have to read goiters, hypothyroid, subclinical hypo. Then Wernicke's encephalopathy and Korsakoff syndrome. Then we have rheumatic fever, lithium, both the various dystrophies, motor neuron disease, and from the ENTs, sometimes they ask about the various tests and autosclerosis and Meniere's disease. In esophagus unit, if I talk about, their favorite is Ecclesia cardia. In stomach, H. pylori infection is a very hot topic. And about the various scores, they talk about the MELD score and the Child-Foch score. And they ask you about the various syndromes of the midbrain, pons and medullary, visual field effect. And from rheumat unit, ankylosing spondylitis is their favorite topic. Then Wilson disease and esophagitis is a very hot topic. Every alternate year this question is asked. They will provide you the history and you have to diagnose which type of esophagitis they are talking about. Then from the B cell T cell disorder, these 3 you have to read. Then in infections, you have to read dengue, malaria, enteric fever and the COVID-19. Guaranteed topics, we are done with the VIP topics. Let's shift toward the subject wise important topics. So, this is the third priority list. So, subject wise important topics in pediatrics, you just have to read the 3 trisomies, Turner, Kalman, breath holding spell, about the tricuspid atresia, cerebral palsy, conjunctivitis, tuberous sclerosis, hypothyroid, hypoglycemia, breastfeeding, what are the good attachment positioning, corrected age in preterm, neural tube defect and the glycogen storage disease, and the rest these are the topics in which you have to read the ORS, short stature and the danger sign of newborn. These are the very hot topics. In anesthesia, you just have to read only 3 topics, the post lumbar puncture headache, drugs causing pain or injection, and the third one is adrenaline. From the psychiatry, we have dementia, panic disorder, hallucination, delirium and erectile dysfunction. And from the derma, we have bullous, pityriasis, vitiligo and tinea versicolor. From the ortho, only 3 topics, Klippel field, psoas abscess, carpal tunnel syndrome. from medicine you have to read the infective endocarditis, dissection of aorta, differential cyanosis causes, H. pylori eradication treatment, and ITP. Then you have heavy metal, acute renal failure, lung diffusion, pericarditis, CCF. So take the screenshot of all these topics. From platelets, recurrent thrombosis, reactive thrombosis, you have Wilson disease, gastric lavage. So take the screenshots. SIDH, tumor markers are really important. Then about the ECG basics. ECG basics are very important. Mann syndrome. Then we have shock and the sleep cycle. These are the trending topics these days. And peptic ulcer and acute fatty liver of pregnancy. Then we have protein losing enteropathy. This is a very trending topic. And eating disorder. And the last is this. So we are done with the important topics of paper 1. Wrote down all the topics in the way I have provided to you all, and after that you decide from which source you want to study. You can choose your coaching notes, and अगर आपको कोचिंग नोट्स में वो टॉपिक नहीं मिलता है जो मैंने मेंशन किया है, देन प्लीज़ रेफर योर स्टैंडर्ड टेक्स्ट बुक, बिकॉज जो लाइन टू लाइन क्वेश्चंस आएंगे वो टेक्स्ट बुक से ही आएंगे. इफ आई टॉक अबाउट मेडिसिन यू हैव टू रीड हैरिसन और डेविडसन, एंड इफ आई टॉक अबाउट पीडियाट्रिक्स you have to refer to Ghai. And if you like the effort I put on, so please drop a heart in the comment section. All the best, keep studying.